Got John. Oh, Andrea's here. I'm going to get, all right.
Great.
So we're all set. Okay, I would like to call the September 20th meeting of Health Services to order. And with that, I would like a motion to approve the minutes of last month's meeting made by Supervisor McDevitt, seconded by Supervisor Conover. Any additions or corrections to the minutes? All right, if not, then we'll call for the vote. All those in favor?
Aye.
Aye. Opposed? All right, thank you, carried. With that, Rob, I will turn it over to you. Good morning again.
Very good. Good morning. Thank you. So the first item that I have on the agenda is a resolution request to transfer funds. I think folks are aware that there's a line in the Warren County budget for psychiatric expense criminal. That's the title of the line. And there's two things that get paid out of that line. One is under New York State Criminal Procedure Law 730, defendants can be examined, evaluated for competency to stand trial. And the county has some contracts with local psychologists that do those evaluations for us. Those contracts are set at $175 an hour. And so those evaluations get paid out of this line. Every defendant, when an exam is ordered, there are two examiners assigned to do the evaluation. If they disagree in their opinion, sometimes a third examination is also ordered. But then if the defendant is a felony level charge, has felony level charges, and is found to be not competent, they are sent to a state hospital, forensic hospital, for a restoration process. And the county gets charged back for those a per diem rate. It's over $1,000 a day. So when this happens, it can be fairly expensive to the county. That's 100% county charge at this point. It used to be that the state paid 50% of that, but they changed that last year. So we're now in a situation where when this happens, the county gets charged at 100%. So the other thing that's happening here is that the billing from New York State is on a bit of a lag. And so we've just received a week or two ago our June bill. So the June bill we've received for the chargeback was $31,483.27. So we had budgeted in this line $25,000 this year. Now, given the fact that this defendant was in June, then I went back and looked and did some investigation with the state to determine how long was that individual actually there. And that individual did stay through July and a bit of time in August. And you can see in the handouts, there's a chart that shows these charges. I also learned that there was a second individual who went in August and is currently there. The day I checked on this was still there in September, mid-September. And so between those two individuals, we've incurred $104,220.48. And then, of course, we still have the examinations that we also pay, as I mentioned, out of that line. So we'll have to allow for that through the year as well. So I wasn't sure how the committee wanted to handle it today. I put together the resolution request. Harry Carlson, my fiscal officer, and I looked at our own budget to see where there's some areas where we could transfer funds from our budget. And so we found some different items that would total to $9,800 that we could offer toward this. And then you can see at the bottom of the request fund form that then we'll have to do something in regard to the contingency account. Now, I did find out from Rob Lynch that the contingency account that we've used to transfer funds for this in prior years currently has $118,000. So regardless of what amount we choose, I'd put 4,000 down there, but we might want to do more than that. It's up to the committee, obviously. What I'm proposing is just enough to pay the June bill. So we need to look at something further out to cover the expenses through the rest of the year. And we may need to do a fund balance transfer into that contingency account or somehow to cover expenses that are probably anticipated to be more than what's currently there.
All right, Mr. Conover, I saw your hand. Do you have a solution for us?
Not sure, but do you want me to bring it to the floor, make a motion, bring it to the
Yes.
floor for discussion? I'll make that motion, bring this forward.
All right, the second the motion, Supervisor Hogan. All right, Mr. Conover?
Yeah, I think for Mr. Thomas, I think that I don't think we want to handle this on a month-to-month basis. I think that that's not the way to deal with this. At the same time, it's a dollar amount that probably, given the amount of time left in this year, beyond our contingency. I don't think we want to wipe out our contingency, so I'm not sure that leaves much but our fund balance. So I guess the information I would need to know to make a motion, Madam Chairwoman, would be what's it going to take between now and the end of the year.
Right, I was wondering about that too.
We can modify it. I think we can modify it by the state revenue, which we expect to arrive sometime.
All right, okay, I was gonna say, Mr. Moore, I think also had a suggestion, but Rob, are you gonna be able to come up with an amount for us that you would need by the end of the year, from now till the end of the year?
Well, it's really it's a little bit unpredictable. I mean, we can estimate, like, if it seems like that the average time for a competency restoration is somewhere around 60 days. So we see when people go in, they usually stay about 2 months. So we could make a projection, and obviously we'll know by October, November, if that second person is still in there or how long they stayed. And then whether there's anyone else that goes in, it's just fairly unpredictable, honestly.
Mr. Moore, I'll come back to you then.
That was exactly the point I was going to hit. I just wanted to ask that question as to how predictable is what is our ability to forecast out for the remainder of the year.
Yeah.
To continue, Madam Chairwoman.
Yes, I'm sorry. Go ahead, Mr. Conover.
Well, then we need the best guesstimate, I guess, is what we need at this stage. I mean, we can always come back. I mean, I would try to be conservative. I wouldn't go over the top with this, but at the same time, I don't know that we want to be dealing with this on a hand-to-mouth basis. We need to have some dollar amount here. I don't know, Ryan, what are your thoughts? Some lump sum amount, I guess.
It would really have to do with the particulars with who this is and how long we think the restoration to competency will take. I would be wary of appropriating too much fund balance. Right. I mean, it'll go back into the general fund anyway, but once we appropriate it into the budget, it's theoretically available to be transferred elsewhere.
Or should we handle the amount that Mr. York is looking for now and hope that he could come back in October and give us maybe a little bit better idea of what we'd need for like October, November, December?
I would actually look to Rob's recommendation on this, because he knows a little bit more about certainly than I do about the case at hand.
Okay,
Well,
Rob, go ahead. What do you think?
Sorry. Yeah, I would think that I probably will have to come back, but I would think maybe it makes more sense that I come back in November or December. Because of the lag in the billing, it is going to be difficult to know anything much more in October other than this one individual. And then we could have additional expenses, in November and December. So I would say that we do something now that we already know that we've incurred over 109,000. We haven't actually been billed for it, but we will be. And So I guess I would suggest that we do something, more significant that would allow me to pay the July, August, and September bills as they roll in. And then we'll come back toward the end of the year with something more of a closer estimate.
All right, so what figure do you think we're looking at then now for this, the ones you're just talking about?
Well, again, so we've incurred 109,000 through mid-September.
Mhm.
So I don't know, somewhere around and we have to pay for the examinations that will continue to be ordered through the rest of the year. So I don't know, somewhere around 110, 120,000.
All right, the committee, what are your thoughts on that? Mr. Conover?
Yeah, I mean, prepared to make that motion at 120.
Okay.
And then if he needs more, and like you say, Madam Chairwoman, if in November that's insufficient, then we can deal with it then. But at least we're covering what he needs with a little bit more. If the staff is comfortable at 120, I guess I would turn to the staff.
Mr. Moore?
Just a point of clarification, Rob, will we be talking about 120 in total out of the fund balance in lieu of doing the transfers that you laid out here, or in addition to doing these transfers?
No, I'm sorry. So I would say maybe 110 out of the fund balance, because we're close to 10,000 here with the 98 that we've identified.
Okay.
All right, so then, Mr. Conover, do you want to change that motion?
Yeah, I think that we're looking at it. There's a 10,000. Is it running around 10,000 a month right now?
Well, no, the chargebacks for one person for 1 month are 31,000. So
Rob, you're going to be satisfied though if we transfer 110,000. Is that what you're saying? Because you said you have like 10,000 from the next page that you've laid out that you could use, right?
correct. And I think Supervisor Conover was probably just kind of looking at it on an average basis, about 10,000 a month, and that's correct.
All right, so any more we have Mr. Conover making the motion for 110,000. Do I have a second to that motion?
I would second that, and I'd also like to ask a question if I can.
Okay, you've made the second, certainly, Mr.
Okay,
McDevitt.
does Mr. Carlson have any comments on what we're proposing here? Harry?
Is he there?
Yeah, Harry, did you hear the question?
What was that? I'm sorry.
I would looking for your economic observation in terms of what we're doing here. If you think it makes sense in terms of what you know about the issue.
I'm sorry, I really missed the discussion of what you're asking for. Sorry, so doing what? I'm sorry.
This was, Harry, this was for the, to cover the chargebacks expenses. It's proposed that we transfer 110,000 from the fund balance together with our 9,800 we identified in our budget, and then come back later in the year with any other further adjustment.
Yeah, it sounds good. I think that's the only way you can approach this.
Okay, thank you, Harry.
All right, any other
Sorry for
questions?
the confusion there. I just was looking at something else. My bad.
If there are no other questions, then we're going to vote on this. All those in favor?
Aye.
Aye. I'm sorry, Mr. Moore.
Just to a clarification, just so we know what we're voting on.
Right.
We're voting on everything on this transfer sheet, which represents a little less than $10,000 up top. And are we doing an additional $4,000 from the contingency? Or are we not doing the contingency?
Rob, which were we doing? Just the 98 from the top, or are we doing the 4 too?
Well, again, I would leave that up to the committee. The contingency is what we've used in the past, and I checked with Rob Lynch, and he said there was 118,000 currently in the contingency account. I think some of the prior discussion today was whether to use contingency or to take a fund balance transfer.
What I understand the motion to be, and correct me if I'm wrong, please, is we're doing the 4 transfer lines that are on the attachment, 1,500, 2,800, 3,000, 2,500. And in addition to that, we're doing 110,000 out of the fund balance and nothing out of contingency. I just want to verify that everybody's on the same page there.
That's my understanding. I wouldn't go after the contingency for such a large dollar amount. I think I would deal with this directly out of the fund balance.
Okay,
Leave the contingency because we still have a ways to go now. Frank's got a ways to go here this year between now and the end of the year.
no, that's
We
true.
wipe out the contingency. Where
Is that okay with you then, Rob?
Yes.
Okay, so shall we try this again? Any more discussion? Any more clarification? All right, all those in favor? Aye. Opposed? Thank you, carried. All right, Rob, I guess it's the budget next, huh?
Okay, thank you. Thank you, everyone.
You're welcome.
Yes, so for our proposed 2022 budget, our fiscal officer, Harry Carlson, has put this together for us. And Harry was part of our budget meetings with the committee. And I'm going to turn it over to Harry to walk us through the proposed budget.
Do better this time. Yeah, basically on the budget, you will notice that there were some increases related in the amended budget and then in the departmental requests for most of the contract agencies. This is related, this year we got a 1% COLA increase to our funding. And 3 quarters is in this year, and then 1 quarter is projected for next year. Basically, the difference this year is that normally the COLAs came through on a specific to the staff in each agency where they went back. And this one, they just took 1% of the total state aid that each agency got. So once you see if you see any kind of increases, that's related to the COLA, it's totally covered by state aid, no cost to the county on that one. Our particular budget, the administration budget, again, most of that is salaries, fringe benefits, so that's the bulk of it. As far as the remainder of it, we have a couple of percentage increases tied to the property and our membership dues. And what we also did in this is to increase the projected federal salary sharing by $8,000 from 72 to 80,000. This sometimes is a little hard to project exactly how much money is coming in. Like last year, we got 5 quarters of funding from this. So I'm hoping that it gets back down to where we, just get 4 quarters of funding, so it's easier to budget. But basically, any kind of increases as far as, the contracts are tied to state aid. The only kind that there might be a county impact is on our budget, and that's really going to be driven by pretty much the salaries and the fringes, but also our increase to the federal salary sharing will help mitigate some of that increase. The only one that we don't have any money tied to is in the past, we always got something tied to the district. And I think that's finally done. Every year I say that's done, but they keep coming back. But I think this year and next year, we will not get any more district monies. I think that's pretty much it. It's pretty standard or basic. Any questions? Let me try to answer.
Any questions from the committee, Supervisor Conover?
Yeah, in terms of the issue that we just dealt with, which code would that come under?
Well, that's at the very end of the budget.
Maybe Ryan would know.
4390.
The code is A4390.
A4390, and I guess I would ask if I might, Madam Chairwoman,
Yes, go ahead.
ask them for a reaction to these numbers as opposed to the kind of numbers we just discussed. I mean, I'm probably reading this incorrectly, but in any event, I show, am I reading it correctly? The submittal for psychiatric criminal, 4390, our adopted was 25, our amended was 25, department requests are 25,000. Is that correct?
Yep.
I mean, is this year an aberration? Is that what we're saying? What? Where? I guess just some reaction from staff relative to that, and then maybe Frank might want to wade in here too.
So, yeah, we have had some discussions, both internally and with the budget committee. Also some follow-up that I've had with Administrator Moore, especially in light of this request to have to amend. Just looking at, maybe a 5-year average looking back is somewhere around 50 to 60,000, but we have had this change in the split of those costs, which, as I mentioned, it used to be split 50-50 with the state. So now it's 100% county responsibility. So it might make some sense to bump that up from the 25, and Administrator Moore did seem to agree with that.
Mr. Conover?
This is a follow, and I'm satisfied with that response. So this is a matter to be discussed between the county administrator, Frank Thomas, and the department.
All right, sounds like a good idea. All right, any other questions on the budget, Supervisor?
Just maybe a quick question or observation. I think, over the years, I can remember Rob saying, a number of occasions that this was a budget item that was unpredictable. There were some years when it would be just because it was a court mandated situation. So in some years, it would be a rather low number under budget, but now we've hit the other end of the cycle, and so here we are. It just again, Rob, is my evaluation accurate?
Yes, in 2017, our expenses out of this line, we had budgeted 25,000. Our expenses were 4,200. In 2018, it was 100,885. 2019, we bumped it up to 40,000 at the budget, and our expenses were 20,966. In 2020, we left it at 40,000 and our expenses were 14,728. And then this year we had knocked it down to the 25,000, and our expenses year to date are 109,471. So it's a great variability in it.
Thank you.
Thank you. Any other questions? All right. Thank you, Rob. We appreciate that.
Hey,
Do you have anything else, Rob?
I just had an additional discussion item. I thought that I would just make the committee aware of
Great.
some discussions that we've been having related to the Joseph P. Dwyer Veterans Peer Services Program. If folks recall, this is an initiative that was funded by the New York State Senate, and there were several pilot counties initially back in 2012, 4 or 5 counties, and then each year they've continued to add counties, and the Senate has appropriated funding for this program. This is targeted toward veterans who are returning, and was named after Joseph P. Dwyer, who was a young veteran who died from an overdose after returning and being diagnosed with PTSD. So the idea of the program is to develop veteran peers that do outreach and support for our veterans. We received funding for this a couple of years ago. It's $185,000. It's a shared program with Washington County. So the $185,000 covers the two counties. We initially had, this is money that flows throughout to us on our state aid letter through the Office of Mental Health. We had initially set this up under the veteran service agencies, that we felt that it would be a good fit for them. And it's just really not turned out to have worked as well as we thought it would in being set up that way. So we've had some discussions with Washington County. County administrators, chairs of the boards have been involved in those discussions. And we've made a decision to go out to RFP with this. We have looked at some other programs across the state and how they're set up and run. And there's some innovative ideas out there. Rensselaer County is working through the Hudson Valley Community College, HVCC, through their Veterans Resource Center. And many other counties have like a mental health agency in the community that operates the program. So we're gonna take a look at things. Maybe SUNY Adirondack, they have a Veterans Resource Center, or maybe one of our mental health agencies will be interested in operating the program. So that's just an informational item. I don't know if anyone has any questions.
Any questions? We appreciate the fact, Rob, that you're helping us out with this and you're going to work on the RFP. I think that's wonderful. So thank you very much for that. All right, if that's it, then I think we're finished then with mental health, and we will move on to Office of the Aging. Thank you very much, Rob. See you next month.
Thank you.
And Dee, are you there?
I am. Can you hear me?
Yes, we can.
The first action item that we have is permission to fill a meal site cook number 7 position at our Long Lake meal site due to resignation on September 3rd, 2021. 25 hours a week, grade 2, $13.93 an hour.
All right, someone like to bring that motion forward. Supervisor Stroud made the motion, second by Supervisor Hogan. And I see that it was because they were offered a full-time position managing a restaurant. So you can't say, shouldn't do it. They're looking at bettering themselves. So any question on that one? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Go ahead, Dee.
All right, so on to our discussion items. We are going to be having 3 individuals virtually attend the ACUU conference, which starts tomorrow. Each individual will cost $155, and this will be half Warren County and half Hamilton County covered.
All right,
So it's just an informational item.
all righty.
The next discussion item is our 2022 budget.
All right,
So with that, the first page is the Hamilton County budget. The second one is the Warren County budget. Overall, our budget is set to go up approximately $10,000.
Mhm.
The third page is our long-term care ombudsman one, which everything goes through the Warren or the Hamilton County. The same for the next page, which is DSRIP. I'm just not sure why they continue to print out that way, but they do. Then when you go into the budget worksheet itself, pages 1 and 2 go over Hamilton County revenues. Pages 3 and 4 go over the Warren County revenues. Pages 5 and 6 go over the Hamilton County expenses. And then the final pages go over the Warren County expenses. So I'm not sure if there are any questions on our 2022 budget.
Any committee member has a question, please feel free to ask. No, Supervisor Hogan, I'm sorry.
No, it's fine. Thank you. Did you adjust the foods in anticipation of the,
So the current budget that's before you was based on the conversations back on August 23rd, where we were anticipating using mom's meals for all of the meal sites. So most of our money was put into contracts. But based on the recent events, the monies will, once the budget goes through, we can shift them back into foods and to supplies where they're going to be needed. But regardless, this is the amount that we would need based on the worst case scenario for the upcoming year. And that's what Administrator Moore suggested, that we do the budget. This is the one that he wanted us to go with for this year.
Mr. Moore.
Thank you. I can speak to that. If you look back at the summary page for the 2021 adopted budget, as Dee indicated, this budget represents about a $300,000 increase. So the tax levy impact of the current year budget is $810,755. That's just expenses minus revenues, $810,755. Around the time when we reviewed the budget, we looked at two different scenarios. We looked at a scenario that had everything in it, if you will. It had the mom's meals contract and it didn't touch any of the staffing, left the staffing whole. That's where we came out of the August 23rd meeting. That's the scenario that's represented here. The tax levy impact is $1,107,990, and the change from 21 to 22 is $297,235. The budget review team had a different version of the budget that didn't have the mom's meals and had an estimate of food in it. And that scenario would have had a tax levy impact of $1,009,220 for a change of $198,465 more expensive than this year. So when Dee asked which version to submit, I said, go with the higher number, because when we work through it, when the budget officer works through it, based on the conversations that we have at the board level as to where we're going with the program, we can make those adjustments. I think it's wise to have a high number in there because the prices of food are up. We're only just getting started with Cisco, and we don't know what the delta is going to be just yet. So the starting point being the higher tax levy impact is the more conservative way to go. That's why we have it in there like that. The other piece that we can consider doing is utilizing ARPA funding, and we've spoken to that concept. In fact, we spoke to it on Friday, the concept of would this board support utilizing ARPA funds in order to run the meal program as close to normal as we possibly can. And that would be a potential as well to blunt the impact of this if the board wanted to go in that direction.
Okay, thank you for that explanation. Are there any other questions from the committee? All right, do you have anything else to bring to our attention?
There was a referral pending item that came from the Personnel Committee, so I put that on the agenda. I'm not sure exactly what it was, if it was just the measures that we were going to be taking to try to fill the positions, or if it was something else. But we have put all of the positions on social media. We are doing a campaign with the Chronicle, and then we're also looking at doing a campaign on local radio stations as well to try to get our positions filled.
Okay, and I think at some point, Dee, we have like a couple of committee members along with me that I think would like to meet with you to see if we could discuss what's hopefully is going to be happening at these other meal sites. So maybe within the next week or so, we could find a time when we could just kind of sit with you and discuss that, if that's okay with you.
Absolutely.
Okay, thank you very much. All right, if there's nothing else, then we're going to move on to public health portion of our meeting. And thank you, Dee. See you next month. I'll talk to you before then.
Thank you.
You're welcome. Hi, Janelle, you all set?
Yes, good morning, everybody.
Morning.
Hope you had a nice weekend. Our first item of business is request resolution number 1 to authorize a contract with Laura Sullivan, an occupational therapist, DBA Laura Sullivan, to provide occupational services for eligible children on our Committee of Special Preschool Education, which is our CPSC program, and early intervention programs at the current rates, authorizing automatic renewal unless there is a 30-day written termination notice by either party or a rate increase of over 5%. There's a great need for therapy providers in our CPSC and EI programs. The therapy is revenue generating. New York State reimburses CPSC services at 59.5% and early intervention at 49%.
All right, would someone like to bring that motion to the floor then? Supervisor Hogan, seconded by Supervisor Stroud. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? All right, carried. Thank you.
Thank you. Resolution request number 2 is to approve filling and request referral to the Personnel Committee to approve filling a vacant full-time senior account clerk number 2 position, which is a grade 7. The base salary is $35,491. This is attachment number 2 in your packet, the intent to fill. This position became vacant in September through a resignation. The position is responsible for insurance verification and billing.
All right, someone like to bring that motion to the floor? Supervisor Stroud, seconded by Supervisor McDevitt. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
All right, resolution request number 3 is to authorize accepting a $225 donation to Health Services. This is a donation that was received in memory of one of our patients and appreciation of our agency and recognition of the care provided by one of our nurses.
Very nice. All right, someone like to make that motion? Supervisor Hogan, seconded by Supervisor Stroud. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Number 4.
I'll turn it over to Ton. This is to amend our 2021 budget to reflect the receipt of the $225 donation.
And that's just attachment 4, showing again the coming into, we're just putting it into miscellaneous expense at this point. We're not sure where we want to utilize it, and the revenue is into revenues, gifts, and donations account for 225. And I do just want to add, this is multiple donations, not just one donation.
Oh, okay. Thank you. All right, would someone like to make that motion then to approve or disapprove that resolution? Supervisor Hogan, seconded by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried. Thank you. Thank you, Tom.
And our 5th resolution request is to authorize a 2021 budget transfer. And again, I'll turn it over to Ton.
Our first request is to transfer funds, again, a nurse that we utilize in our public health for family services, but right now we're not seeing children. So she's been utilized in our disease program to help with all of our COVID tracing and contacts and anything else that's needed. So the last 2 quarters I've moved over salaries to fund for that. And this time I'm moving it again, $15,000 in salaries and some fringe benefits. The second one is regarding some call pay that we have anticipated and are utilizing for nurses that are being on call, asked to be on call with the COVID numbers rising. We've had to make some adjustments and make sure that they're getting call pay for being ready for these situations. And again, this is just to the end of the year. I'm moving $3,000 and then with fringe benefits basic fringe benefits related to that. And that's, both of them are in the disease program, both of them totally related to all the COVID activities going on right now. The total is $21,179 for both of those transfers.
Okay, thank you. Would someone like to make that motion for the transfer? Supervisor Hogan, seconded by Supervisor Stroud. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. All right, what's next?
Attachment number 6 is our financial status that was as of September 8th. You'll see again where we stand for revenues and salaries and expenses and revenues. Our salaries, which we list down below, will give you an idea of where we stand. We're below in regular salaries from last year, and that is primarily due to the positions that are open in our home care right now. We have nursing positions. Our overtime and our part-time salaries are over, and that is all related, obviously, to the COVID activities going on. Just to bring to your attention, however, that we are at 57.78% of the budget as of this September date, where at this time last year, we were at 64.11. So again, even though we're over, in general, overall, we're under the budget accordingly from last year.
Good.
And then attachment number 7, again, is just a summary, just to give you a snapshot of September 8th of last year to September 8th of this year, giving you an idea of where we stand. The salaries I just discussed. Equipment, we had 3 vehicles that we had purchased so far this year. Contractual, again, our preschool programs have mainly caught up, and we're pretty much caught up with all our contractuals. And some of those costs obviously have gone up, especially like in our transportation for the getting the children to and from preschool because of gas prices and of COVID and everything that's happened there. And the revenues, this was as of July. We just closed the month of August, so you'll see that in next month financials, but this was as of July for both years with our revenues. Slightly right now, it looks like it's a little bit up, but I know with everything with referrals, I will say the home care, our referrals are down. Also with the nursing staff being down too, we haven't taken as many referrals. We take what our nurses can handle. And so our referrals reflect that. So that again was these referrals, we did give you some last month for July, but they weren't final. So this is the final numbers for the month of July on attachments A, at 8A and 8B, giving you an idea for referrals. You will see that our referrals have gone down for both and visits have gone down for both. Again, reflecting our status right now. We're still recruiting, trying to get nurses in for our home care. That's all I have.
All right, the next attachment is our emergency response and preparedness activity sheet. That's attachment number 9. And shows all of our excitement with COVID response primarily. Then we have our rabies report, which is attachment number 10. And I've also attached a copy of our rabies clinic schedule for people's towns or for the general public. Our next clinic is, or actually was this past Saturday. Our next one is going to be October 9th. We collaborated with the dog park up in Johnsburg, and they requested that we come up, and we needed a clinic up north anyway, so it worked out well for a win-win. And let's see, that is all I have at the moment. I don't have any meeting or conference authorizations. There were no referral or pending items. Didn't know if you wanted privilege of the floor before I go into my budget.
No, I think we'll just go into the budget, please. Oh, excuse me, Mr. Conover.
Yeah, on the question of home visits and nurses and that whole issue, I wonder, I mean, I guess the first question is if we can't take the referrals, who is taking the referrals, if anyone, and if people are having a difficult time finding, what are our thoughts on that? I don't expect you to answer today, but it would seem to me that, you know, if the need is there and they're not able to find assistance elsewhere, you know, what do we think about that, and how do we respond to that, if at all? You mentioned that our difficulty in getting nurses. Just that entire situation seems just set off a red light with me, a concern with me relative to this wonderful program that we have. So I don't expect a response today, but it would seem to me that hopefully, you know, you have people looking at from a picture point of view and how to address this. I don't know. You see what I'm saying here?
There are a couple thoughts, Supervisor Conover. The first is a lot of the home care agencies are experiencing the same issues with staffing. And one of the other trends that we're seeing, and a lot of it has to do with revenue and the way that Medicare pays, is a lot of patients are going to short-term rehab facilities before they go home. And so that's taking some of the patients, you know, and that's one of the reasons why our referrals are down. But the other thing is, like, with our nurses and not having enough nurses, we only want to take the patients that we feel comfortable being able to serve. And I think if we're not able to take them, some of the other agencies are able to. I'm not familiar of anybody that absolutely has no care. If there are people like that, I'm happy for your towns to reach out to us and let us know, because obviously we're a gap filler ultimately. But I think all agencies are kind of on the same board right now. We're all seeing a dip in our referrals. Some of that's because a lot of the patients are going straight from the hospital to short term. But then, you know, we also have staffing issues as well.
Thank you.
Does that answer your question, Mr. Conover?
Oh, it does. It does.
Okay, good. Janelle, before you go on, I just wanted to take a moment to say congratulations to Jody Burns, because she successfully completed skills training in effective team management, leadership essentials, and conflict resolutions. And we would like her to know that we as a committee appreciate her doing that. So, and I have a certificate that I will get to you to give to her. So thank you, and make sure you thank her from us.
I absolutely will. Thank you for that.
You're welcome, I'm sure. So want to do the budget now?
Absolutely.
Okay.
So I think the way we're going to start is I have included in our agenda a highlight page that I was going to review briefly, and then Ton will go into our budget overview sheet, if that works for everybody. First of all, in our preventive, I'm going on the 2022 budget highlight sheet. The first topic is preventive, our preventive program. We're looking to add a full-time equivalent position, a grade 21, step 18, which is a public health program manager. We're also looking for the ability to put a provision in for emergency on call for a per diem rate for our director and assistant director of our agency. We only put in for like 100 days. We're hoping COVID will be over by March. But this isn't like just to receive one phone call. This isn't like to work a couple hours. This is if like we're called and working a whole day kind of scenario. That's when this would be utilized. We're also looking to rebuild our public health program to align with state aid. I've been with the agency for almost 28 years. We've had programs and we've limped along to meet the state aid requirements. And I think with COVID kind of totally decimating a lot of our programs, in addition to some retirements and things like that, we have the opportunity to rebuild our public health department based on our state aid deliverables. So I'm excited about that. And this full-time equivalent position, the grade 21, I'm looking at to help coordinate the different program people for that, so that we're able to do that. These expenses are eligible for state aid. In health services in our CHA, we're looking to eliminate 3 of our vacant nursing positions. I believe, Ton, don't we still have 5 remaining?
Yes.
We still have 5 remaining, so we're not cutting ourselves too short. We're looking to increase staff nurse call rate due to recent union negotiations. And that kind of dominoed into our supervisor call rate having to be increased. So we're looking to put that provision in our 2022 budget. In addition, we're looking to add a therapy program administrator position. The administrator position for the therapist is so that we can move a nurse that's currently in that position to help us with the supervision of our nurses, so that we can provide more guidance, instruction, and service and supervision to the nurses that we have, because we have a relatively young in-home care nursing staff. And obviously, we're looking to hopefully get these 5 positions filled, and we'll need to orient those people. And we're looking and anticipating that we'll need our nursing supervisor for that. We're also looking, because of our nursing, we lost one of our coders, so we're having to outsource the coding. So we are looking to move 100,000 to our contract line to cover outsourcing our coding, since we don't have a nurse in-house doing that right now. In addition, we're looking to add 5,000 to the contract line for our physical therapy only cases. When we first admit them, the physical therapists are having to do like an extra 2 to 4 hours worth of work. And we're just looking to increase that rate by $30. And we're looking at, it would be like 166 cases a year. So we've estimated about 5,000 for that. Referrals are based on our staffing, and just note that as we have less staff, we have less referrals. If we have more staff, we have more referrals. WIC is totally grant funded, so there's a 0 impact, but you are going to see a little bit of impact to program, because we've had to take some of that money to cover the salaries that were negotiated this year. Family health, with changes in state aid claiming, outreach and education efforts are preferred versus like seeing a mom's client. Again, we're gap filling. We'll do what we need to do and be where we need to be, but we are trying to triage visits to see if there's other ways to meet some of those needs within the community and to work with other agencies to take care of those needs. But we are willing to kind of help with that as needed. And with COVID response, 2020 and 2021 have been off what our norm was. We're hoping to get back to normal in 2022. Our disease control, we're looking at staffing. We're going to transfer a full-time registered nurse, number 40, from our ComCare and put that into our disease control staff. That's our immunization nurse that we want when we were talking up on the top on the preventive program of having a provision. Right now, I have a per diem nurse in charge of my immunization program, and I think a full-time person is going to be better, and then also to meet our state aid needs as well. We're adding an on-call rate to cover the program after hours for weekends and holidays on the public health side. We're looking to add overtime to be able to cover our clinics, contact tracing and testing while we're still in COVID response. And then we're looking to transfer 65,000 from our ComCare line to disease control for contact tracing. And that's just going to help us cover some of those expenses with our contact tracers. We're hoping to do our influenza clinics and COVID clinics as we go. As you know, the ACIP, or the Advisory Committee on Infection Practices, has now approved booster doses for 65 and older, in addition to those that are immunocompromised. So we're going to have to be circling back to get some of our people a booster dose. In addition to, we want everybody to get a flu shot this year that's eligible. Our STD clinics, we're still looking into contracting out, which will hopefully reduce overhead cost. We do share that clinic with Washington County right now. Washington County, Warren County are working on ideas and resources on how to outsource that and possibly contract those services out. Our clinics have had 0 to 10 people a week historically. And on those weeks that we have 0, we have staff sitting here, so it's quite expensive to sit here for nobody coming. But yet, if we figure out a way to outsource, we might be able to meet the needs of the public better. So we're working on that. All the things I just mentioned under disease control are eligible for state aid if there's no additional grant funding to cover that. Looking at our health education, we're looking to delete the senior health educator position. We're hoping this is a position that we're hopefully going to promote up to the other grade 21 position mentioned under the preventive program. And we're looking to add 2 public health educator positions, which are grade 14, to help us again with our state aid related work. We're estimating revenues in about $4,000, hoping things get back to normal through our CPR classes that we do throughout the community. We're hoping to continue COVID-19 education and outreach. We've worked a lot with our schools and other places within the community. We're also looking to offer other health education programs. We do this in schools. We do this for seniors at meal sites. We do this for other community groups as well. We're looking at tick and tick-borne disease education and prevention. We're looking at tobacco, vaping, substance abuse, and the anticipated marijuana education. Again, all the health education services are covered under and are eligible for state aid claims. Our early intervention, we're just looking to increase staffing a little bit by having a per diem service coordinator, which is a grade 18 for up to 10 hours a week. And with our New York State Department of Health, we had an ELC, which is a grant to kind of help with the school testing and support school testing needs. We're expecting a zero impact. What we buy is an eligible claim under the grant, and then we get reimbursed for that when we voucher it. We have $500,000 for school testing related expenses. And just to remind you, the full grant was 1.7. And we're using some of that this budget year, which is why there's a little bit of a difference. So with that, I'll turn it over to Tom. Oops, I'm sorry. Oh no. And with that, I'll turn it over to Tarn to review the budget summary piece, because she's better at the numbers than I am.
Hello. Okay, the other thing we attached to the budget is also a summary sheet. You'll see that's a long 11 by 14. That's a summary of all of our agency departments. And basically you go down and you'll see the pages. We'll tell you each one for home care, for our WIC, goes right in a row with what all of Janelle was just saying. When you go over to I don't know, 1, 2, 3, 4, 5, 6, 7th column, we're looking at a $2.8 million effect on the county. If you look at our profit or loss or based on the amendment for this year's budget, we're estimating about a 2.3. So we are looking at a little over $500,000 increase, just basic with our budget request. And the peach columns next to those, one is our estimated payroll adjustments, which is our pages 44 through 46 on the big budget, if you have the whole page, but this just summarizes it. And again, it's all the positions that Janelle talked about, eliminating, deleting, moving, whatever we want to do. The net effect of our payroll adjustments is $261,200. And as you know, a lot of it has to do with what public health now needs to do to make sure we meet all the needs that is necessary. And some of it is COVID related. Then one thing we added another column is, and this is the bare minimum, is that we assume we will get 36 on certain public health programs only. We get state aid of minimum 36% back. So that is the effect where we show the additional revenue of $143,205. That's based on these salary increases that will change. Again, lots of times with these COVID things, we may end up with it being something we'll get a grant. So obviously, if we get a grant, that'll affect it and that'll cover it more. So, and again, if we don't have the expense, we don't have the revenue. So just keeping all of that in mind. And then after these, if all these approvals get made for the salaries, we're saying then it would go up to $3,007,000 impact on public health. Public health has had, as you're aware, with all the COVID and everything going on, kind of hit us on the head, slap side. We had to try to figure out what we're going to do. So there's a lot of things that Janelle's been thinking about as an agency, what we need to do to be better prepared next time and just have more coverage and make sure we're ready. So there's, you know, like she said, the positions we need to create and the things they need to do regarding education and coverage. We've tried to take, we hope, everything into effect into that to keep us going forward into the future. I don't know if anything, like you said too, about the school grant, it is a 1.7 million. We're anticipating, don't know if we will, but again, we're anticipating about $500,000 to use this year. The grant does end next July. So if something happens where we feel we need to use all 1.7, it is there, but we did budget about 500 for this year. And like we said, we're going to budget about 500,000 for next year. Again, all fully covered, and we would only utilize it for expenses that are covered by the grant. I don't know if anyone has any questions. And I will tell you, a lot of the obviously increases are due to what was just passed with the union negotiations and salary increases that just happened and what anticipate happening in January of 2022. So especially in the home care and especially in our WIC program, actually most of our agent, I mean, most of it is salary related. And again, fringes related to that too. So that is why you see the increase in going on comparable to where we are this year.
Committee members, any questions? Don, that was a great report. I know the amount of work that goes into it, and we do appreciate that. So I guess at this point, we have privilege of the floor. Mr. Lehman, do we have anybody that's out there that has anything to say?
Hi, no, we do not have any comment on YouTube.
Hey, thank you very much. With that, then I will entertain a motion to adjourn. Supervisor McDevitt, seconded by Supervisor Hogan. All those in favor? Thank you very much. And Ton and Janelle, we'll see you next month. Thank you.